I do believe for the broad economy's health and for fiscal health, we do need to address the problem of increasing cost. And so any program that is undertaken should look to how we're going to get control of costs so that it will not bankrupt both our government and eventually our economy. Just urge you that as you look at other aspects of healthcare reform, that you keep cost on the front burner.
I think that we are moving closer, we are making progress, and that I have no question that we have the votes on the floor of the House to pass this legislation.
That was Federal Reserve Chairman Ben Bernanke and House Speaker Nancy Pelosi on Capitol Hill talking about the health care overhaul legislation. A big focus. President Obama is going straight to the American public tonight in a primetime news conference to build support for overhauling the health care system, as you must know by now. We have gathered different perspectives to discuss the proposed reform, which is causing a divide within the Democratic Party. Here with me on set is Jeffrey Kang, Chief Medical Officer at Cigna over in Washington, D.C. is Richard Kirsch. He is lobbying for President Obama's plan. He is the national campaign manager for Health Care for America Now. Also in our nation's capital is John Rother, Executive Vice President for Policy and Strategy at the AARP. It supports pieces of the House bill. We'll talk about that. And from Albuquerque, New Mexico, Doug Holtz-Eakin is a former director of the Congressional Budget Office. He says the bill adds to the deficit as far as the eye can see. All of you, welcome to the show. Thanks for joining us.
Thank you.
I want to start, Richard, with you, because you guys are lobbying for this, and a lot of the opponents of this bill say, hey, this is very complex stuff. It's a lot of very big legislation, and we risk, rash actions lead to reckless policies. Is this too much too fast?
Well, only if you consider waiting 100 years too much too fast. There's been more than 79 hearings in Congress and the House alone. This has been an issue that's been debated and worked on for decades and a lot intensively this year. The Republican Party has made it very clear. They said delay is their strategy for killing this. Their goal is to kill reform. Senator DeMint said if we stop President Obama in this, it'll be his Waterloo, we'll break him. So those who want to delay this are basically trying to kill it for their own political purposes.
Doug, what do you think? I mean, opponents have said this is a lot like Fannie Mae and Freddie Mac, where at first it was supposed to broaden home ownership for America, and in the end, it didn't work out so well, and it ended up curtailing, or may end up curtailing, home ownership. Is this going to prove to be another time bomb?
I think there are really three important points. And the first is that there's broad consensus that we need health care reform, and this is a year in which there's the opportunity to do something very, very important for the American people. The second is that the bills we've seen so far aren't health care reform of the type that we need. And CBO Director Doug Elmendorf was very clear about the fact that the House bill will make our fiscal problems worse, not better, and that should be a key consideration. And there is some rush here because these bills are being put before the committees before CBO's had a chance to read them, and that's a dangerous precedent.
Let's ask a couple of people who should know if we need health care reform and how, and I'm going to start with you, Dr. Jeffrey Kang, Chief Medical Officer for Cigna. What do you think about health care reform? I mean, generally, doesn't everyone agree that we need some sort of reform on this?
So absolutely, and the insurance industry agrees that the goals of universal coverage and making the policies affordable is absolutely right on target. We believe, though, that we can accomplish that with health insurance market reform and then with a competition in the private sector offering affordable premiums. To give you an example, in the employer market, where 150 million people get their insurance, the average premium that consumers pay, a family of four, is about $280 a month. That's very affordable. We think with the appropriate reforms, we can bring the same thing to the rest of the insurance market.
What do you think, John Rother from the AARP? Is this affordable? I mean, you represent a lot of people who may be having problems, maybe stumbling on health care affordability.
I think, first of all, the employer market works pretty well. What does not work well is the individual and small group market, where people are paying many times that amount for premiums today. And so that's what this reform is aimed on, is lowering costs for people who don't have the help of an employer and keeping that cost curve down from the 8-9% a year that's clearly unaffordable today. So this has to go after waste. It has to go after achieving affordability, and it has to do it in a way that keeps everybody together. I think that's going to be something that would be better done sooner rather than putting it off even more.